We appear to be in the middle of a presidential election. I don't know if anybody's noticed, but it's a little controversial. But if you had a chance to speak with the candidates, we got one question related to Alzheimer's, what would you ask them?
That's a good question. Actually, at the beginning of all this presidential debates and all this stuff, I think at the first round of the presidential debate, the next day I had a lecture in Berkeley. And I actually said, there was exactly about dementia. And we talked about Alzheimer's dementia with the people in Berkeley. And then I brought it up last night. The people discuss about a lot of other things. I mean, the personal attack and all this stuff. But I haven't heard even one single word from anyone that what will happen to our future with the amount of the dementia. Again, you saw the video at the beginning. We know about the numbers that we have increase of numbers of the people. The Alzheimer patients going to triple in the next 15 years to 20 years. But the reality is the people getting affected by dementia, which is actually if you multiple times 3. For myself, I calculated 50 million of people in the United States. If there's not going to be any treatment for dementia, take about in the next 15 to 20 years, and all these people is going to continue with increased longevity as well. And as you know, we have in the next 15 years, our aging population will be double. And California state, we actually have a more aging population, but we have more number of the people. 11,000 people every single day they enroll in Medicare. Just think about it. And then, and if we do not do anything today, tomorrow we're actually going to facing a lot of tragic stories. The reason of tragic stories, I bring it up, maybe different discussion, but the families, they are taking care of them. Financial support for them. I'm a physician, I'm not, you guys probably knowing more, but I have many of my patients' family, they've been bankrupted just by taking care of the dementia patient. Or they have a person in the family. And I don't see any movement in the country. And I try to kind of, spread this message to everyone that we should do something for future. And I'm always bringing that example that if Alexander the Great, who was actually trying to find water of life, or fountain of youth to live longer, if he was alive today, he probably regret about what he actually wanted years ago. Because that's about the living in 21st century. Nobody listened to what will happen. First of all, we do not have a number of educated people to actually knowing about this disease. I mean, I'm not talking about a physician, forget about physician. We just talk about everyone. We also talk about the nurses. Again, the only association I see that, planning this kind of events and educating the people is Alzheimer's Association. And one day I was thinking about if we don't have them in this association, what happened to our society? Because we really do. Take about the sleep and dementia. I'm as a geriatrician, I still don't know a lot. I don't know. And again, I'm as also a geriatrician, I still need to learn more. But and a lot of my training, a lot of people that I train them, and a lot of my fellows and all this stuff that we train them, they need to know more. We need to train more nurses, more people, more caregivers, like a lot of families. But I asked them, I think for future, more important that a lot of I call all the presidential debates is kind of like a stand-up comedy, but I really like to hear a different message from the people about, just not about dementia people, throughout the entire aging population in this country.